This is Dr. Roush, and welcome to the module on healthy environments as part of the Family and Community Assessment course. Now, this module provides basic concepts and tools for nurses to integrate environmental health into our practice and daily lives. The environment is everything around us: the air we breathe, the water we drink and use, and the food we consume. It's also the chemicals, radiation, microbes, and physical forces with which we come into contact. But when the physical environment is polluted, this pollution is not only around us, but it is in us. Now, according to the ANA Nursing Scope and Standards for all RNs, the registered nurse integrates the principles of environmental health for nursing in all areas of practice. This means that every nurse should improve his or her knowledge and skills to reduce environmental hazards and promote health. And this is no matter what our level of nursing education, no matter where we work. We need to advocate for environments in which people can not only survive, but thrive. I like that last quote very much. "10 Americans" is a very powerful video. It was put together by the Environmental Working Group, and in it, President Ken Cook tells the story of 10 Americans to make the case for overhauling the nation's main chemicals management law. This is a very powerful story, and once you hear it, you'll be able to apply it as we go through the rest of this presentation. So now I'd like to just tell you a little bit about a case study of the toxic ash sites in Jacksonville. And we'll discuss parts of this as we go through the rest of the presentation. Now, Diane Kurz, who's a community activist, worked with community volunteers in North Riverside neighborhood to build a butterfly garden for the children in Duval County's Head Start program. And soon after it was finished, it was closed, the garden and the school, by the EPA because the soil was contaminated by toxic ash. This is only one story about the presence of toxic ash sites in Jacksonville. The story behind it is that about 1.7 square miles were contaminated by 3 city-run municipal incinerators that operated between the 1890s and the early 1970s, and they burned trash into ash, and this left toxic levels of arsenic, lead, dioxins, and other metals in the soil. Residents at the time say that ash that wasn't scattered by the wind, buried in a nearby landfill, or seeping into the ground beneath the incinerators was sprayed onto the streets, which were dirt at the time. R.L. Gundy is the pastor of Mount Sinai Missionary Baptist Church, and he grew up just a few blocks from one of the incinerators, and he remembers playing in it. "You could smell it, you could see it, but you didn't know what it was," said Gundy, who now has been diagnosed with prostate cancer. He talks about how many neighbors and friends have been stricken with cancer and other diseases, but they don't know for sure if the earth below was the reason or the cause. These ash sites were designated by the Environmental Protection Agency as Superfund sites, which means they were the most hazardous, and they were designated in the 1990s. But specific information was not communicated to residents until they demanded it in 2005. They were growing suspicious that government officials weren't providing the whole truth and weren't moving fast enough to protect them. So more than 4,000 ash site residents said the city violated their civil rights and sued for dumping ash in the predominantly poor black neighborhoods and exposing them to health risks. They demanded the city close ash site schools, which include the Head Start school and another elementary school, and it did. There were heated community meetings, protests, and other threats of lawsuits, and the city settled for $75 million in 2006. When it was over, one resident said if they had stopped the denying, "I don't think it would have cost them so much." In 2008, Jacksonville began the $94 million cleanup and deemed it Project New Ground. The cleanup process requires the removal of up to 2 feet of soil and replacement with clean soil. In addition, They turned around the way they communicate with people and developed Project New Ground, which has a website, an information center, and holds monthly meetings for residents. And you'll see how all of these things play out as we go through the rest of the presentation. Now, the ash identified as toxic included arsenic, lead, dioxins, and other metals. So, toxicology is the study of these poisons. And there's a major federal agency that's dedicated to toxicology in public health, which is the Agency for Toxic Substances and Disease Registry, or the ATSDR. And it provides information for professionals and consumers about toxic substances, carcinogens. So be sure to go onto their website and look at the information it has about different toxic substances, but also they have maps to show you where the toxic hazards. You've already learned a little bit about epidemiology, but when we're looking at epidemiology and environmental health, a lot of times what we're looking at is, are there links or an association between a disease outcome and an exposure to some kind of environmental hazard? So for the minister in the story about the ash sites, we want to know, is there a link between his exposure and his development of prostate cancer? In this kind of work, we do work in a multidisciplinary approach, but look at the different disciplines that you are working with when we look at environmental health. And certainly geologists and chemists would be very important to the study when we look at the toxic ash. But there are many here, and it's a really rich sense of work, a rich experience when we're stepping outside of our own field. So of course, we start with assessment, and the I Prepare mnemonic helps you do an environmental exposure history. And this was actually created and validated by nurse researchers at the University of Washington, at the ATSDR, and occupational health nurses. And I'd like to go through these letters briefly. But the first one is looking at investigating potential exposures. So it's like differential diagnosis. You have someone who comes in with some kinds of symptoms and you say, could these possibly be coming from the environment? So you would ask a question like, do you have any symptoms that improve when you are away from your home or work? The P is about your present workplace. Are you exposed to solvents and dusts and fumes? One of the really important pieces of this is, do you wear your work clothes home? Depending on what you're exposed to, you could be contaminating your car and every place that you are with those work clothes on, which can affect the rest of your family. Residence. When was your residence built? What's your source of drinking water? What chemicals are stored on your property? Lead was in paint before 1978. So if you have an older home, it might have lead paint. And you notice that lead also was in that toxic ash. Lead can be very toxic for children under the age of 5 because their neurological system is still developing, and it can cause neurological deficits. And if it's in the paint and the paint is flaking, children will eat the paint chips, which from what I hear taste very sweet, although I haven't tried them myself. The next one's environmental concerns, and one of them is, do you live near a hazardous waste site or landfill? If you go back to the story, you can see that people were living next to this hazardous waste site or landfill and didn't know it for a very long time. So it would not come out in their history at that point in time. What was your past work experience? I think one of the most powerful examples of this is asbestos and mesothelioma. People who worked with asbestos in the past. showing up later with mesothelioma, which is such a rare lung disease. Activities are next. What hobbies do you have? Do you eat what you catch or grow? Do you use pesticides? Are your kids eating the soil, which they do quite a bit? Are they inhaling dust with particular toxins in it? And as you know, the toxic ash is in the soil and has many different kinds of toxins that the children can get into. Referrals and resources is next. If you go to your textbook, you can see they give you lots of information about the Agency for Toxic Substances and Disease Registry, the Occupational Safety and Health Administration, the local health department, the Environmental Protection Agency. You need to know about these different places so that you can actually make relevant referrals. And finally, educating. Are materials available? Are alternatives available to minimize the risk of exposure? Have prevention strategies been discussed? And what's the plan for follow-up? Think about integrating the types of questions here into your usual health history that you do. We do have to talk about risk assessment, though, in children as a very vulnerable population. Children are not little adults. That children are uniquely vulnerable to environmental hazards is well established in the scientific literature. And in fact, the World Health Organization recommended more than a decade ago that when health risks from chemicals are evaluated, the special characteristics of infants and children must be recognized. They have a risk for greater exposure to environmental hazards. Pound for pound, children breathe more air, drink more water, and consume more food than adults. And this higher rate of intake means that children will receive higher doses of whatever contaminants are present in the air, water, or food. Let's think about childhood behavior, and the typical nature of that also increases their exposure. An infant frequently explores objects by placing them in his or her mouth. And this common hand-to-mouth behavior increases an infant's ingestion of substances in the soil, household dust, floors, carpets, and on the objects themselves. I like this quote from the EPA. It says that we should assume that children aged 3 to 5 years old put their hands to their mouths on an average of 1.5 times per hour. They also have an increased susceptibility to the health effects of environmental hazards. So human infants and children differ from adults not only in their size, but also in the relative immaturity of their biochemical and physiological functions. Childhood is characterized by rapid physical and mental growth, and accordingly, certain organs may not be fully developed and may be more vulnerable to injury. Children absorb, metabolize, and excrete compounds very differently than adults. But they also have more years of future life than most adults. Therefore, they have more time to develop any chronic diseases that might be triggered by some earlier environmental exposures. Now, the Emergency Planning and Community Right to Know Act was enacted by Congress in 1986, and it was set up to establish requirements for federal, state, and local governments, tribes, and industry regarding emergency planning and community right to know reporting on hazardous and toxic chemicals. And the whole idea is that they want to help increase the public's knowledge and access to information on chemicals in the environment where they live. So basically, the resources that you have here, the material safety data sheets and the Consumer Confidence Report, which comes from the Safe Drinking Water Act, ask questions like, what is it, what do I need to do, and how do I start? If you think about your workplace and the material safety data sheets, you should have a big book of them or some kind of resource with them for all of the different chemicals that you work with. And you probably saw this in your orientation and hopefully have not had to use it